Welcome back. While coronavirus dominates the headlines and maybe even some of our own thoughts, doctors are now warning about another threat. Now, one thing COVID-19 does is open our bodies up to secondary infections like pneumonia. And to help fight them, powerful antibiotics are needing to be prescribed. But as those antibiotics are being used more and more, concern is now growing that they're being overused, leading to a potential rise in antibiotic-resistant germs or superbugs. Concern about superbugs is really nothing new, but we talked to the Chief Physician Executive for Community Health Network, Dr. Ram Uleti, about how in a pandemic it's especially troubling.
There is a definite concern that not necessarily due to overprescribing, but the fact that the COVID-19 is causing other infections, especially if you're in the hospital, that we're going to be running out of antibiotics in our arsenal and how to treat patients.
Now, Dr. Uleti says while COVID has been a big contributor to these issues, it's something that a lot of us are bringing on ourselves. Too often are people relying on antibiotics to clear out issues that don't often require them. Couple that with our societal need for speed and expediency, the use of quick visit urgent cares or virtual visits as opposed to talking with a physician that knows and has studied your specific situation and medical history, and that can lead to the overuse of antibiotics. And while expediency is certainly important, it's even more important to think big picture as opposed to immediate impact.
And we just need to realize that, for your own long-term health, that it's you that gets it. Because if you next time you do have a serious infection and your body's resistant to this antibiotics, but you took it when you didn't need to, then you're the one who's going to actually end up suffering in the long term. And so our body remembers these antibiotics individually. So if you get something today and you get antibiotic today and you didn't need it, you may develop a resistance. And next year, if you're sick with something more serious, that same antibiotic won't affect you as well. So it's really about your own well-being for the long term, not just the short term. But those are not always easy to appreciate or understand.
Yeah, Uleti says the most important thing is to have an honest conversation with your health provider about what you're actually experiencing and don't rush things. He says sometimes the best medicine is a little bit of rest and some chicken noodle soup. A lot of people, though, we hear it all the time. Oh, yeah. They feel anything, the sniffles, anything. The first thing they say, I just want to get like a Z-Pack and knock it out. And with quick visits like urgent cares, sometimes that conversation isn't being had, and it's easier to write a prescription for something like that and then move on to somebody else who needs help, So.
And as patients, I mean, like you said, we just want to be over it quick. And it's something that a lot of us don't even think about.
Right.
What are the other options?
When you pose, well, I can be out of work for the next 5 to 7 days, or I could take something and be good to go in 2 to 3.
Employers might have something to do with that too,
Yeah, I think they do a little bit.